Thank you for choosing the BNMS website. My name is Simon Hughes and I work in Birmingham in the United Kingdom. I'm a consultant in radiology and nuclear medicine. We would like to give you a short YouTube presentation, and this is in conjunction with the principal PETCT radiographer, Andy Nightingale, and one of the principal clinical scientists here in Birmingham. This is a small presentation to indicate 4 regions which can be checked during the routine acquisition of a brain scan. These can easily be checked by radiographers while the patient is on the scanner, and these can help guide whether a repeat study may be of benefit if the patient is able to comply with that and perform a new study. Accurate positioning is important in brain imaging, and this improves both the interpretation and the manipulation of any images following the acquisition. Some simple tape across the forehead and the chin, lightly applied and then attached to the headrest with appropriate cushioning, can help keep the patient immobile. Keeping your head still for the 10 to 15 minutes of an acquisition can be difficult without any sort of reference to guide you. We also encourage people to use the standard positioning of the brain with the orbitomeatal plane, so that's the outer canthus of the eye being in a vertical plane with the external meatus of the ear, and you can use lasers to help align that on most modern PET-CT scanners, and lasers to align the mid-sagittal plane of the face. Important to realize for reporters as well that an aligned face does not always mean that the brain is aligned perfectly. This accurate interpretation then makes interpretation for the reporter easier, and also the manipulation of those images for statistical parametric mapping or PET MRI reconstructions are also easier because of that. The first standard that we're going to suggest is to look at the very superior part of the brain. So this is usually the superior parietal lobe, so the most superior slices in a well-positioned brain. And what we should see here is a clear wavy line of FDG uptake within the grey matter of the brain. So the grey matter is the intensely active part of the brain that covers all the folded gyri over the surface of the brain. What we don't want to see is blurring of these wavy lines, any abnormal connections, and the CT component can guide you here. We don't want to see any strange ring patterns or oval patterns. So you should be able to look at the CT component of the PET-CT reconstruction, and you should be able to follow the same pattern of FDG uptake within the higher intensity grey matter. The second component to check is called the anterior limb of the internal capsule. This is a deep tract of dense white matter between the head of the caudate nucleus and the putamen within the brain stem. If you click, a more magnified view of the FDG uptake pattern within the brainstem will appear. If you click again, 2 red arrows will appear, This shows the reduced FDG uptake within the right and the left internal capsules, and this is the pattern that we're going to look for. Keep clicking and you'll see that there's prominent uptake within the head of the caudate nucleus, indicated by the yellow C, and you'll see that on both sides. There's prominent uptake within the putamen in the region of the yellow P. And note the prominent uptake within the thalamus in the yellow T, and again symmetrical on both sides. So this is a common pattern of FDG uptake within a normal brainstem. When we get movement during the acquisition, then we can lose this low activity track within the anterior limb of the internal capsule, between the head of the caudate nucleus and the putamen. Just as an aside, those of you who have seen DAT scans also show uptake within the head of the caudate nucleus and the putamen and give that characteristic tick appearance. And this is an analogous pattern within a more detailed FDG uptake. The third component we're going to check is called a posterior cingulate gyrus. So there's both a right and a left posterior cingulate gyrus. We can see these on the axial PETCT images that we're showing you here, and the red arrows show the red and the left posterior cingulate gyrus. So these are two long tracts, and on the axial images they show up as two separate spots of activity. And these run sort of deep to the posterior parietal and the medial posterior parietal and medial occipital lobes. But we should really be seeing them as two separate dots at this level. And with movement, we lose these two separate dots and they just become one sort of vague region of activity. And so we're looking to maintain the two separate spots of activity. The fourth region we're going to check is the right and left colliculi. So these are at the very posterior aspect of the base of the brainstem. So they're usually very deep to the occipital lobe, centrally. They're actually on a thing called the quadrigeminal plate, and they have this little quadrigeminal plate cistern, that's a little U-shaped black line on the CT component. And what we should see is two dots, both a right and a left colliculi. They're part of the visual tract, and so they're usually always intense activity. And again, with inappropriate movement, we lose the separation between the right and the left colliculi. So looking at these four regions, the superior parietal gyral pattern, the reduced activity within the anterior limb of the internal capsule, between the head of the caudate nucleus and the putamen, looking at the separation of both the right and the left posterior cingulate gyrus, and looking at the separation of the right and the left colliculi. These can be introduced into the routine review of FDG brain imaging. I think these can become a rapid thing to learn and can be used by the radiographer to assess whether there has been any technical issues with the acquisition prior to the patient leaving the scanner. And what we suggest is if two or more of these quality indicators are lost, then think about repeating the study if that's possible. We hope you found this small YouTube presentation useful, and we hope you introduce these quality standards into your service.